Hi, I'm Dr. Manmeet Ahluwalia. I'm a medical oncologist, and I serve as the Chief of Medical Oncology, Chief Scientific Officer, and the Deputy Director of the Miami Cancer Institute. I'm very excited to be here at ASCO, where we are presenting a poster in the CNS section on a trial that I've been involved in with a number of colleagues around the country. The trial's name is LIMITLESS. It is basically looking at MR-guided focused ultrasound along with immune checkpoint blockade in patients with non-small cell lung cancer brain metastases. Lung cancer, as we know, is one of the most common tumors that actually goes to the brain. So 50% of patients with brain metastases actually have lung cancer origin. And so it's a common clinical problem that we face every day in our practice. Traditionally, the treatment of patients with uh, brain metastases has been radiation. But in the last decade or two, there has been an increasing role of medical therapies. But one of the challenges in brain metastases is that we have this issue of blood-brain barrier, which is a lining around the brain, which limits the availability of the drugs to get into the brain. So because of that, now we have a very unique technology where you can use focused ultrasound to non-invasively disrupt the blood-brain barrier. And that's the premise of this trial. So this trial is supported by a company called Insight, which has developed this XBlade 4000 system, which can be used to non-invasively disrupt the blood-brain barrier. And essentially, let me walk you through to this very exciting poster that we are presenting here. And essentially what we are doing is that we are using MR-guided focused ultrasound, basically which then is using circulating microbubble resonators, which then allow for controlled temporary opening of the blood-brain barrier. And essentially, the blood-brain barrier then stays open for anywhere from 4 hours to 24 hours. We have actually done MRIs to show that the BBB closes after a day. And so what it does is it allows us to deliver new drugs to the brain. And this is especially important because we have a lot of large molecules like antibody drug conjugates, which are really transforming outcomes of patients with cancer. So in this particular trial, though, we are looking at anti-PD-1, and one of the most commonly used drugs, as we know in the clinic, is a drug called pembrolizumab, which is given to these patients with or without chemotherapy. And essentially what we are doing here is this is a randomized prospective multicenter trial, which is open at Cleveland Clinic, University of Maryland, the Johnston Willis Hospital in Richmond, Ivy League brain tumor program in Phoenix, University of Toronto. And what we are doing is we are randomized patients 2:1 between two arms, where one arm, which is basically the experimental group, is undergoing the BBB opening, and both the patients in both the arms are actually going to get systemic treatment as per their treating medical oncologist, and essentially which is either a combination of immune checkpoint inhibitor or combining that with systemic therapy. And basically the eligibility criteria for the trial is patients more than 18 years of age, performance status of more than 70, that's what we use in the brain, normal organ function, they have to have non-small cell lung cancer with brain mets, and at least one brain met needs to be more than 0.5 centimeter, so we can actually see the response rate. So then patients who get randomized to the experimental arm will get a blood-brain barrier opening done with the focused ultrasound, and then they get 6 cycles of ICI or immune checkpoint blockade, which is on-level therapy, and that's what is the active arm or the experimental arm. And the other arm will actually just get the standard of care therapy, or that's the control arm. And essentially, we have actually enrolled the first portion. We will be presenting the safety data and efficacy data at upcoming meetings, but we are very excited about this potential opportunity of using this modality, because one of the challenges that we have in brain mets is often use radiation. And radiation, although effective in controlling brain metastases, can sometimes be associated with neurocognitive deficits. So one aspect of this study is, can we use non-invasive ways of disrupting blood-brain barrier to increase the efficacy of our agents, especially immune checkpoint inhibitors? And then we are looking at other trials, designing it with antibody drug conjugates. And we are really excited about it because if we can do this, we will really transform the field of brain tumors, both primary brain tumors as well as brain metastases. And we know brain metastases is a very common clinical problem. Every year, up to 200,000 patients are diagnosed with brain metastases in the United States. And a lot of times it's a common cause of morbidity and mortality. So we are super thrilled about our trial and the implications of it in really transforming care for these patients. Thank you for your attention.